Everyone, welcome to all four e-learning classes. Session 7. The breathing and exchange of gases which involve the respiratory tract, respiratory organs. Next, the mechanism of the breathing. Mechanism of breathing. Respiration, we have discussed that it is inspiration and expiration. The muscles that assist in respiration said to be the intercostal muscles, to the phrenic muscles, and abdominal muscles. These are what the muscles assist in respiration. That is intercostal muscles, in the sense the muscles associated with the ribs. The muscles that are associated with the diaphragm are what named to be the phrenic muscles. The muscles of the abdomen. So three type of muscles involved in respiration. Now the inspiration and expiration, we see intake of the oxygenated air and sending out the foul air is expiration. So inspiration, the principal muscles of, make a note, principal muscles of inspiration are principal muscles of inspiration, we term it as external intercostal muscles and phrenic muscles. External intercostal muscles, and the phrenic muscles are what said to be the principal muscles of the diaphragm. Principal muscles of inspiration, we say, is external intercostal muscles and phrenic muscles. What I mean to say is, we discussed that inspiration in which the external intercostal muscles contract as well as the diaphragm muscles contract. External intercostal muscles and the phrenic muscles contract. So these muscles contraction, the anterior-posterior axis as well as the dorsoventral axis, the thoracic volume increases. So that's the reason why we consider the intercostal muscles and the phrenic muscles are what's said to be the principal muscles of inspiration. In the same way, since their contraction, the inspiration takes place. So inspiration is a active process. The same way, expiration, sending out air outside. There we discussed that relaxation of the external intercostal muscles and relaxation of the phrenic muscles. And the point to remember, that's the reason why it is what is called the passive process. Why? There is no muscular contraction. Whereas normal expiration is a passive process. What about the another? There are three we see. One is a normal inspiration, normal expiration, and forceful expiration. Look at here. I am forcibly sending foul air to the outside. So where I am taking my abdomen inside. This is, I am applying force on the abdomen, which is said to be the forceful expiration, where the abdominal muscles are what influencing. So inspiration is a active process. Make a note, the inspiration is an active process. Normal expiration is a passive process. but forcible expiration is a active process. The forceful expiration is because of contraction of abdominal muscles as well as contraction of internal intercostal muscles. So here we see, if you are asked a question, so if I ask you a question, that is the muscles that assist in respiration are intercostal, phrenic and abdominal, whereas the inspiration is a dash. Inspiration is a dash in the sense the active process. Expiration is a dash. It is normal expiration as well as active expiration, which means normal expiration is passive process, whereas forcible expiration is a active process. Forcible expiration is active as the internal intercostal muscles contract as well as the abdominal muscles contract. We have already discussed that about 12 to 16 times per minute the respiratory beats takes place, which is measured by means of spirometer. Spirometer, a device which measures the number of the respiratory rate. Next, after that we have discussed the pulmonary volumes and the pulmonary capacities. Basically, for clinical assessment, the pulmonary capacities are being taken. Now let's discuss the exchange of gases is. Generally, the exchange part of the respiration is none other than alveoli of lungs. Alveoli of lungs, we have discussed that it is the exchange part. Alveoli are lined by means of simple squamous epithelium and also blood capillaries. The diffusion of the gases, exchange of gases depends on 5 factors. 1. The partial pressure of a gas. 2. Solubility of gas. 3. Thickness of respiratory membrane. 4. The distance travelled by gases. And the respiratory surface. I repeat, the exchange of gases depends on 5 factors. 1. Partial pressure of a gas, the pressure of a gas. 2. The respiratory surface. 3. Thickness of respiratory surface or thickness of respiratory membrane. 4. The distance travelled by gases and solubility. So 5 factors we discuss. And generally the question raises, what is a partial pressure of a gases? Regarding oxygen, we say PO2. PO2 in the sense partial pressure of oxygen. PCO2 in the sense the partial pressure of a gas, CO2. PO2 in the sense partial pressure of oxygen. PCO2 in the sense partial pressure of carbon dioxide. The diffusion depends on the respiratory membrane. The thinner the respiratory membrane, the faster the diffusion of gases. The respiratory membrane, which is 0.2 millimeter of thickness, it is the combination of the simple squamous epithelium. Simple squamous epithelium lines the alveoli. So simple squamous epithelium and its basement membrane. Next, endothelium. The blood vessels innermost layer is named to be the simple squamous, which is said to be the endothelium. And nothing but simple squamous. Whose basement membrane? So 2 plus 2, and the space between that interstitial, that is the internal space between that. So these are what forming the respiratory membrane. Respiratory membrane is about 0.2 millimeter of thickness. It is the combination of simple squamous epithelium of the alveoli and its basement membrane, endothelium of blood vessels and its basement membrane, and space in between these two. This is what forming the respiratory membrane. It is very thin, 0.2 millimeter of thickness through which the exchange of gases takes place. Now, generally, how do we discuss that gases diffuse from partial pressure of high to partial pressure of low? Diffusion of gases. Now, how to calculate, how do we know the partial pressure of a gas? Partial pressure of a gas can be defined as the pressure exerted by, the pressure contributed by a gas in the mixture of a gas is what name it to be the partial pressure of a gas. Individual partial pressure of a gas can be calculated by the pressure exerted by an individual gas in a mixture of gas is named to be the partial pressure of a gas. Generally, oxygen percentage in the atmosphere is 20.98, that is what we see. The composition of the air, if we see, oxygen, carbon dioxide, inert gases are what can be seen. Oxygen percentage, oxygen 20.92 or 98, 20.98 is the partial pressure of oxygen. Out of the mixture of gas, basically we take as a consideration of mercury. Make a note this which is an important point that you are not available of the textbook. That is, the mixture of a gas, we say it is a mercury. Mercury partial pressure is 780 mmHg. 780 mmHg. So this is a mixture in which the individual exertion of pressure of oxygen, which is nothing but the 20.98 by 780 into 100. If you calculate this, you will get the what is called 159 mmHg of the partial pressure of a gas. That is nothing but partial pressure of a gas. Earlier we have seen so this is how, that is, an individual mixture is nothing but the mercury. In the mercury mixture, the mercury which is in which the individual gas percentage of oxygen is 20.98. That is how you will get to know the partial pressure of the oxygen is 159 mmHg. In the same way, we see the alveolar partial pressure of oxygen is 104 mmHg. That in the oxygenated blood 95 mmHg, whereas at the tissues it is 40 mmHg. In the same way, the carbon dioxide partial pressure at the tissues is 45 mmHg or 46, slight difference. And then in the systemic veins which take the blood from the tissues, where the partial pressure of carbon dioxide PCO2 is 45. Then in pulmonary capillaries 45, at lungs it is 40 mmHg, whereas atmospheric is 0.3 we say. So 46, 45, 45, 40 and 0.3. Here 159, 104, 95 and 40. What do you get to know? You get to know that the diffusion of the gases from partial pressure of high to partial pressure of low. And this is the concentration difference of the gases which allow the diffusion. One of the points we have seen, partial pressure of a gas, solubility of the gas. The higher the partial pressure of a gas, the higher the solubility. Then diffusion through the respiratory membrane. Then at the tissues, where again the partial pressure of oxygen is low at the tissues. Lower partial pressure indicates the higher demand. so it is supplied. Lower partial pressure, lower solubility. This dissociates the oxygen from the blood. So this is how it supplies. This exchange of gases that we have seen. Generally, the solubility of carbon dioxide is in blood plasma 20 to 25 times 20 to 25% more the solubility of the carbon dioxide more in plasma when compared with the oxygen. This is the reason why more amount of per unit volume of the of pressure, the solubility of carbon dioxide is more when compared with the oxygen. That is, the exchange of gases takes place through the membrane, which will be more for the CO2. Why? As its solubility is more. That's what the exchange of gases, which can be discussed under two headings. One is named to be the pulmonary exchange of gases. Pulmonary exchange of gas. Pulmonary exchange of gas. And the another is said to be the systemic exchange of gas. Systemic exchange of gas. Systemic exchange of gas. Let's see what do you mean by this. What we discussed is at atmospheric air we have discussed, where the oxygen partial pressure is 159 mmHg. The individual pressure accepted by a gas in a mixture of gas is the partial pressure of a gas, which is denoted for oxygen PO2 and for carbon dioxide PCO2. So the partial pressure of oxygen is 159 mmHg at the atmosphere. As the gases drift from higher partial pressure to lower partial pressure, while lower partial pressure is created at the lungs, we have discussed it. The thoracic cavity is where the lungs is present, is an airtight chamber. Any change in the thoracic volume bring about the change in the lungs, as lungs do not bring about change directly, for which the phrenic muscles and intercostal muscles play a role. Due to the contraction of external intercostal muscles and the contraction of phrenic muscles, diaphragm muscles, due to the contraction of external intercostal muscles and the phrenic muscles, anterior-posterior axis and dorso-ventrally, the thoracic volume increase. When volume increase, pressure decreases. This causes the drifting of gases of oxygenated air from atmosphere diffuse into the lungs. At lungs, look at here, the partial pressure of oxygen PO2 is 104 mmHg. Look at here. Look at here. The partial pressure of oxygen PO2 104 mmHg, whereas the PCO2 is 40 mmHg. Now, let me ask you a question. The solubility of a gas, whose gas will be more? Whose gas solubility will be more at a particular place? The gas whose partial pressure is more, whose solubility will be more. Now answer. Here, when compared with oxygen and CO2, whose partial pressure is more? Oxygen. So point evident. Then, as its partial pressure is more, its solubility in the blood will be also more. Right? So, and its surface area is also more, since it is with high partial pressure. So, surface area at lungs, the surface area for oxygen is more. At tissues, the carbon dioxide surface area is more, and at tissues, the carbon dioxide partial pressure is more. So, the oxygen diffuse more into the pulmonary capillaries. That is nothing but basically the capillaries that carry the oxygenated blood from lungs into the left atrium. Remember one thing and recall. We discussed that in the heart, the left side portion, left part, left atria, left ventricle carries the oxygenated blood. Right atria, right ventricle carries the deoxygenated blood. So, in this connection, as partial pressure of oxygen is more at the alveoli, so it start diffusing. And look at here, pulmonary capillary, pulmonary vein, where the partial pressure of oxygen is 95 mmHg, less relative to that of the lungs, where 104. So gases drift from high to low. So from 104 it is diffusing into the 95. This is how oxygen from the lungs diffuse into the pulmonary vein. In the same way, look at here. The partial pressure of carbon dioxide PCO2 45 mmHg at the pulmonary artery, which is bringing the deoxygenated blood from right ventricle to the lungs, is a pulmonary artery, where the partial pressure of carbon dioxide is more when compared with the oxygen. That's what it is carrying, deoxygenated blood. And the partial pressure of carbon dioxide at lungs is 40 mmHg, and here 45. So gases diffuse from high to low, so 45 to 40. So carbon dioxide diffusion from the pulmonary capillary into lungs due to difference in the concentration. The same way, oxygen from lungs into the pulmonary capillary, 104 to 95, 45 to 40. So this exchange of gases between the alveoli of lungs into the pulmonary capillaries and pulmonary capillaries into the lungs, O2 and CO2, exchange of O2 from lungs into the pulmonary capillaries, and exchange of CO2 from pulmonary capillary into lungs is a pulmonary exchange of gas. Pulmonary exchange of gases, gas and systemic exchange of gas. The exchange of gases between the lungs and pulmonary capillaries. Pulmonary capillaries and lungs is what name it to be the pulmonary gas exchange or exchange of gases. Systemic exchange, systemic refers to the tissues and pulmonary refers to lungs. So the exchange of gases called the oxygen and carbon dioxide from lungs into the pulmonary capillaries into the lungs is what we term it as a pulmonary exchange of gases. Reason, pressure difference, the difference in the partial pressure, what makes the diffusion of gases from lungs into the pulmonary capillaries and lungs. Here the partial pressure of oxygen is 104 and that come down to 95 here. So gases diffuse oxygen from alveoli of lungs into the pulmonary capillaries. In the same way, the exchange of gases called the PCO2 partial pressure is 45 mmHg here and 40 mmHg here. So the diffusion due to difference, this exchange of gases of oxygen and carbon dioxide between lungs and pulmonary capillary and lungs is what name it to be the pulmonary exchange of gas. The second one is systemic exchange of gas. Systemic exchange of gas, look at here. The exchange of gases called the oxygen from the systemic capillaries into the tissues. In the same way, the exchange of CO2 from tissues into the systemic capillaries. Here this is a systemic artery, whereas here this is a systemic vein. Already I told you that is from tissues to precaval and one postcaval vein. To precaval and one postcaval vein bring about the blood from tissues into the what is called the heart, which is deoxygenated. That's the reason for which the example is whatever the gas whose concentration is more. For suppose if oxygen partial pressure is more here, so this is the pure air, oxygenated blood. Come on, answer. Oxygenated blood carrying are pulmonary vein and systemic arteries. Already I told you. Why? Where partial pressure of oxygen is PO2 is 95 mmHg than that of the oxygen. So it is oxygenated blood. In the same manner, systemic artery with the PO2 95 mmHg and PCO2 40 mmHg. So this is oxygenated blood carrying by the pulmonary vein as well as systemic artery. The same way, the systemic veins, 2 precaval and 1 postcaval vein, whose partial pressure of carbon dioxide is 45 mmHg and the oxygen is 40 mmHg. So it is the deoxygenated blood. Here with the systemic artery, exchange of gases between systemic capillaries to the tissues. Why it is taking place? Here the oxygen partial pressure is 95 mmHg. Here the oxygen partial pressure is 40 mmHg. So gases diffuse from partial pressure of high to partial pressure of low. So here 95 mmHg to 40 mmHg. Generally normally at a resting condition, tissues will have oxygen partial pressure 40 mmHg. So it is transporting the oxygen to the tissues. As its partial pressure is low, so demand is more. So oxidation of food substance takes place. So carbon dioxide is formed. This is the reason why at tissues the partial pressure of carbon dioxide is more, which is 45 mmHg. Even it is we see it is 46. Then the diffusion, as partial pressure of oxygen here 45, so it diffuses. That's the reason why the diffusion of the oxygen from systemic artery into the tissues and the tissues to the systemic veins is what named to be the systemic exchange of gases. So here oxygen is delivered to the tissues. From tissues, carbon dioxide is diffused into the systemic veins. This is what the pulmonary exchange of gases and the systemic exchange of gases. So pulmonary exchange of gases, if we go for the differences, pulmonary exchange of gases between the lungs and the pulmonary capillaries as well as the lungs. That is exchange of O2 and CO2 between lungs and pulmonary capillaries, vice versa, we can say is a pulmonary exchange of gases. Systemic exchange of gases, the exchange of O2 and CO2 between the systemic capillaries and tissues, vice versa, can be systemic exchange of gases. That's what we see. Next, let's see the transport of gases. Transport of gases. Gases transport is involving transport of O2 and the transport of CO2. Transport of O2 and the transport of CO2. Oxygen is transported in two forms. That is, the oxygen transport is of in two forms. That is by what is called O2 transport. Generally, the gases diffusion takes place in a compound forms, not in their original form. In a compound form, not in an original form. What do you mean by that? It means, so far we have discussed the exchange of gases. That's enough, you may think. But how does it is transporting in the blood is the topic to be discussed. Okay. First, in the initial phases, we discussed the gases drifting, respiratory tract and respiratory organs. Then we discussed the mechanism, inspiration, expiration. How is what we have seen, the change in the thoracic volume and the lungs are what causes the exchange of gases mechanism involved. Then we discussed what are the volumes and capacities, that is how the air is inhaled, hold and expelled is a volume, and 2 or more volumes is a capacity. Now the exchange of gases, the reasons we have discussed, everything is fine. Now transport, oxygen is transported, carbon dioxide is also transported. How is what now we'll see. So what I mean to say, it is the transport of gases takes place via the blood, where there is not in their original form. I mean to say the transport of O2 and CO2 is in a compound forms. O2 transported in a oxyhemoglobin form. Oxyhemoglobin. Whereas the case with the carbon dioxide is in a physical solution, carbamino compounds, bicarbonates, sodium bicarbonate, potassium bicarbonate, where CO2 is there. Next, physical solution and carbamino compounds. Carbamino compounds, that is carbon dioxide combined with the amine of a protein, so carbamino compound. Next, with the physical solution, carbon dioxide combines with the water and forms a carbonic acid, that is physical solution. So by all this means you come to know that the transport of gases is in a compound forms, not their original form. Oxygen is in a oxyhemoglobin form. Carbon dioxide is in a physical solution where it is in a carbonic acid. However, carbonic acid is unstable. That is, it is furtherly dissociated into H2CO3 carbonic acid, which is further breakdown into H plus and HCO3 minus. Under the carbamino compounds and bicarbonates. Let's come to the discussion of O2 transport. So O2 transport is in a compound form oxyhemoglobin, and it is by 2 forms, one through plasma and the another is RBC. I repeat, the oxygen transport is in a compound form, that is oxyhemoglobin, both by 2 ways, one is plasma and RBC.